Welcome back. As we address the topic of youth mental health and the growing need for help, we want to look now at the resources available in our Bay Area communities. Joining me now is Dr. Stephen Adelsheim, the director of Stanford Medicine Center for Youth Mental Health and Well-Being. So, first of all, thank you for being here. And my first question, what is the need right now? Paint a picture of that for us.
Well, the reality is we had a crisis in youth mental health well before this pandemic happened. We had many young people with issues of depression, anxiety, mental health challenges that were feeling isolated and having trouble accessing care. And frankly, since the pandemic, the numbers have only increased. We're seeing higher rates of young people spending time in emergency departments, having suicidal ideation, needing additional support. And so all of our data says that our young people need earlier access to mental health supports and ways that they can find services in ways that are very comfortable for them.
You know, what's fascinating to me is we've devoted so much time and dialogue across the country talking about dropping the stigma related to youth mental health or mental health in general, right? But if we get past that hurdle and we drop the stigma and people start asking for help, it's kind of all for naught if the help is hard to find. What do we do systemically to make sure that kids have a place to go, that the resources are available? Because the statistics there, talking about some 60% of kids who have depression can't access actual health or get to help or get to a counselor. What do we do about that deficit?
Well, your point is a critical one. And we've had data for a long time saying half of all mental health conditions start by the age of 14. And yet we have never created the spaces or places for young people to get early care. And we know that early intervention works just as well for mental health conditions as it does for any other type of medical related issue. One of the things we've been involved with in supporting both at the local level, but at the state level as well, is the creation of spaces for young people to come in to get that early care in environments that are comfortable for them. We've been working in partnerships to be building out programs called Alcove, which are spaces for young people that are developed in partnership with youth advisory groups, very active youth voice, to create places by and for young people to come in and get, as you were just talking about, that moment of pause, to be able to come into a safe space to get early mental health supports, primary care, peer support as well, early education and employment guidance, as well as early treatment for substance abuse related issues as well. We've opened up several of these programs in Santa Clara County. One's going to open in San Mateo over the next few months, as well as other parts of the state. So we're excited, and the young people we're working with are excited to have a place that's comfortable for them finally.
Last question, if you can, in about 10 or 20 seconds, looking right into the camera, what's your message as we wrap up this week to a kiddo out there who might be hurting and feeling like help is not available?
Well, it's important to reach out to your friends and also to those of us that are working to develop these programs so we can help link you to the right service and speak up for what you need. Your voice is critical.
All right. Thank you so much, Doctor. I really appreciate you joining us today. Just one more expert talking to us, one more voice in this community conversation. All of us focused on you, the young person watching right now, because you matter.